name is David Best. I'm Professor of Addiction and Recovery at Leeds Trinity University, but I also lead the Inclusive Recovery Cities movement here in Newcastle. For the last 6 months or so, funded by Newcastle City Council, we've been undertaking an activity called Inclusive Recovery Cities that's about promoting inclusivity, reciprocal altruism, and getting people in recovery from addictions actively involved in citizenship through challenging stigma and public celebrations of recovery. Yeah, I'm doing my talk jointly with Steve Wood, who is the lead for Revival Newcastle, and basically we'll be talking about the work we're doing around community connections and mobilising community assets to actively give back and create meaningful pathways for people in recovery to jobs, friends and houses. We know where there are high levels of collective efficacy or greater community contributions, there are numerous public health, public safety and quality of life benefits for vulnerable groups, but for everybody. The city becomes a more inclusive, engaged place with higher levels of well-being across the board.
My name is Flor Christie. I'm an Associate Professor in Public Health in the School of Medicine at the University of Sunderland. I'm here today to talk about community-based participatory approaches to improving health for ethnic minority groups. So I'm talking about two of my studies, the IMCAN study, this improving cancer screening for Muslim women, and the PROCAN-B study, which is early diagnosis of prostate cancer for Black, African and Caribbean men. I think it's really important in terms of tackling health inequalities. Marmot has got these amazing principles that can really support a whole systems approach to tackling health inequalities.
Hello, my name's Guy Pilkington. I'm a GP and I work at Crothers Park Surgery in the West End of Newcastle. Newcastle becoming a Marmot city is a very exciting development. We know that Michael Marmot and colleagues have articulated and explained very clearly what it is that might make a difference to the inequalities that our communities are living with and struggling with. At the end of the day, poverty underpins so much of what we're talking about today, but other than a wish of making people less poor, what Michael Marmot does is give us some pointers to where we should concentrate our energies. And I think the opportunity for all of us to come together and think about those 8 principles and those eight priorities really helps focus the mind. It's a great start, but of course, talking about things doesn't change anything. We need to act on what we're thinking about today, and we need to work closely together and not give up, because to be honest, none of this is new. This has been around for centuries and we need to persevere in our collaborations to see if we can make a difference.
Hi, I'm Paul Court. I'm the Chief Executive of HealthWorks. HealthWorks is 30 years old this year and our patron is Professor Sir Michael Marmot. So it's wonderful to be here at the launch of Marmot City, where Michael is presenting, and it is a fantastic opportunity for Newcastle to make great strides into tackling health inequalities in order that our population lives happier, healthier, longer lives.